Assalamualaikum warahmatullahi wabarakatuh. Welcome back with me, Dheyananda Alfadilah from PBI B. This time I will read a text with the title The Work of the Village Medicine Man. Part 1. Medicine Men and Modern Doctors. In most urban and suburban areas throughout the world, sick people are taken to a doctor's office or to a hospital for treatment. But among tribal and village people in many countries, patients are taken instead to a local medicine man. This medicine man is a combination of a doctor, priest, and psychologist. Some of his folk methods are similar to those of an urban doctor, but most are very much different. The difference in methods is a result of the fact that disease, to the modern scientific mind, is viewed as something natural. It is caused by viruses, bacteria, and other small things that we can't see without a microscope. By contrast, in much of the world, disease is considered to be something supernatural. In other words, sickness is not caused by something physical, but instead is the result of deep anger, broken religious laws, the hatred of enemies, and so on. An urban physician knows how to treat a specific disease. A medicine man, however, treats the whole people and often the patient's family and friends as well. Part 2. Prevention of disease. Of course, there may be no need for treatment if people know how to take care of themselves to prevent sickness. A modern physician might tell his patients what to eat, how much to exercise, when and how to relax, and the like. A medicine man, on the other hand, tells his patients to wear amulets, special necklaces for protection against bad spirits. Nevertheless, in both village and urban societies, people do become ill and sometimes need a medical help. Part 3. The diagnosis. The first step in any treatment, of course, is the diagnosis. The doctor or the medicine man has to find out why the patient is ill and decide what to do about it. For the diagnosis, both asks about symptoms. Is the patient complaining about headache, stomach ache, insomnia, skin rash, but the similarity in the methods and there. The doctor's next step is to give blood tests, take x-ray, and etc. While the medicine man involves supernatural methods. He might ask the patient about his dreams, use astrology to find the cause of the problem in the stars, or go into a trance, a condition of deep concentration in which he doesn't function normally. In an effort, to contact spirits or other beings outside the world. Part 4. After the diagnosis comes the cure. In the modern medicine, the solution usually means one or more of the following. The same methods that are used for prevention, helpful food, rest, and exercise. Perhaps warm baths or massage, drugs, or surgery. Likewise, folk medicine includes some of the same cures. As in the diagnosis, however, a medicine man also uses a wide variety of supernatural methods in his cures. Two of the most common are exorcism and soul hunts. Exorcism is based on the belief that disease is caused by bad spirits. Thus, in an exorcism ceremony, the medicine man performs a number of traditional activities to take the evil beings out of the victim's body. Songs, dances, and religious prayers are part of any exorcism, and soul hounds include them as well. In this ceremony, the medicine man tries to persuade the victim's souls, which are believed to have left their bodies, to return. Part 5. A typical tribal ceremony. The Ndembe people of Central Africa believe that illness is often the result of the anger of a relative, friend, or enemy. This emotion, they say, causes a tooth to enter the body of the person who is the target of the anger and to create the disease. When the medicine man decides which body part contains the evil tooth, he calls together the victim's relatives and friends to watch a ceremony, at the end of which he removes it from the patient's throat, arm, legs, stomach, and etc. Although the patients and the villagers know what has happened, that the tooth has been hidden inside the medicine man's mouth the whole time. The patient is often cured. The Ndembe ceremony is typical of treatments around the world in which stones, insects, or small spears are taken out of sick people. Despite scientific evidence that disproves the effectiveness of such methods, the fact remains that the treatments are often successful and many villagers prefer to be cured in this way than by a modern physician. Part 6. The Success of Medicine Man. Scientists ask how medicine men can actually be successful in their treatments and why they are so popular. The answer probably lies in a combination of the following reasons. First, supernatural ceremony are symbolic, and the people who participate in them believe deeply in the symbols. Even Western physicians agree that patients with deep faith believe in God, their doctors, the drug they take, image, or symbols will regain their health faster than patients with little hopes. Second, ceremonies may be effective because people come together for a common goal. Patients see how many people in their communities care about the cure. In addition, these communal meetings provide socially acceptable opportunities for the people of the village to express what they feel. Social and psychological problems can be solved along with the physical ones of the sick person. Fourth, scientists theories that the transport of the ceremonies produce certain chemicals in the body, which then work to help cure the disease. Finally, many of the medicine man's natural drugs, which come from a nearby forest, jungle, or desert, have been found to be medically effective. Scientists are fascinated by what they learn from the methods of tribal medicine man. Okay, that's all from me. Thank you for your attention and wassalamualaikum warahmatullahi wabarakatuh.